When we picture the healers of ancient Egypt, it is easy to conjure images of mystical priests chanting over the sick, relying on amulets and incantations. We imagine a world where medicine was indistinguishable from magic, a primitive prelude to true science. But what if that picture is profoundly wrong? What if, thousands of years before the stethoscope or the X-ray, Egyptian physicians were performing medical feats so sophisticated that their knowledge would not be matched for millennia? The evidence for this astonishing reality is etched not in myth, but in bone. Consider a human skull dating back an incredible 4,600 years. This is not just any ancient relic, it shows clear, precise evidence of a surgical procedure. The signs of healing around the edges of the incision tell a story not of a fatal experiment, but of a successful operation. Someone in the age of the pyramid builders underwent brain surgery and lived. This single artifact forces us to completely re-evaluate everything we thought we knew. It poses a question that is both thrilling and humbling: just how advanced was Egyptian medicine? This journey into the past is more than a catalog of ancient tools and texts. It is a detective story, a quest to uncover the secrets of history's first true physicians. These were not mere sorcerers, they were pioneers who established the very foundations of medical practice. They conducted detailed examinations, diagnosed specific ailments, and prescribed complex treatments that blended empirical observation with a deep understanding of the human body. Their world was one without microscopes or modern chemistry, yet they developed a medical system that was remarkably systematic, documented, and effective. The mysteries we are about to explore challenge our modern arrogance, suggesting that these ancient doctors possessed insights that we are only now, with all our technology, beginning to appreciate and rediscover. They compel us to look beyond the linen wrappings of mummies and see the brilliant minds that worked to preserve life itself. So, prepare to set aside the simplistic tales of magic and mystery. We are about to step into the halls of the ancient Egyptian physician, to examine their surgical instruments, to decipher their papyrus scrolls filled with precise diagnoses, and to understand the revolutionary principles that guided their hands. We will uncover a world where doctors understood the pulse, treated fractures with sophisticated splints, and even practiced a form of dentistry. This is a story of human ingenuity at its most resilient, a testament to a civilization whose thirst for knowledge and mastery of healing arts remains breathtaking. The journey ahead will reveal just how much we owe to these medical pioneers of the Nile, and it promises to forever change your perception of the ancient world. To grasp the sheer brilliance of Egyptian medicine, we must first step back and appreciate the civilization that made it all possible. This was not a culture born out of chaos or fleeting nomadic existence. It was a society built on an almost miraculous foundation of stability, a gift from the Nile River itself. Every year, with a predictability that became the very heartbeat of ancient Egypt, the Nile would flood. This wasn't a disaster, it was the source of all life. The floodwaters deposited rich, black silt across the river valley, creating some of the most fertile farmland on the planet. This annual bounty meant that Egyptian society could produce a massive surplus of food. And that surplus is the key that unlocks everything. When a society doesn't have to spend every waking moment hunting or gathering just to survive, its people are freed up to specialize. They can become architects, artists, priests, scribes, and crucially, physicians. This agricultural wealth created the economic stability necessary to support a professional class dedicated not to subsistence, but to the advancement of knowledge. Central to this advancement was one of humanity's greatest inventions, writing. The Egyptians developed a complex and beautiful system of hieroglyphs for monumental inscriptions, but for everyday record keeping, including medical texts, they used a faster, cursive script known as hieratic. This ability to write was revolutionary. It meant that knowledge was no longer trapped in the memory of a single individual, vulnerable to being lost forever. A physician's observations, a successful treatment for a burn or a broken bone, a detailed anatomical note from preparing a body for the afterlife, all of this could be carefully recorded on papyrus scrolls. This created a cumulative body of knowledge. A doctor in Thebes could, in a sense, consult with a master physician from Memphis who had lived 200 years earlier. Knowledge became a shared resource capable of being refined, debated, and improved upon across generations. This was the world's first medical library, a repository of empirical data that elevated healing from a matter of oral tradition to a documented science. Within this structured society, medicine emerged as a recognized and respected profession. We have titles from tombs and texts that show a clear hierarchy of medical experts. There were SW&W, general physicians, but also specialists, doctors for the eyes, for the stomach, for the teeth, and even what we might call proctologists. The most famous early physician, Imhotep, who served the pharaoh Djoser around 2650 B.C.E., was not only an architect responsible for the step pyramid, but was so revered for his wisdom and healing abilities that he was eventually deified as a god of medicine. This tells us that the healer held a place of high esteem. They were trained, likely through a system of apprenticeship, and they operated within a framework that expected results. The state supported them, and in return, they cared for everyone from the laborers building the pyramids to the royal family itself. This professional environment, stable, literate, and hierarchical, provided the perfect incubator for medical science to flourish, setting the stage for the astonishing practical achievements we are about to uncover. And it is through these fragile papyrus scrolls, preserved for millennia by the dry Egyptian air, that we can truly hear the voices of those ancient physicians. The most illuminating of these documents are not single pages but lengthy scrolls, some stretching over 20 meters long, representing the most complete medical textbooks from the ancient world. The two most significant are the Edwin Smith Papyrus and the Ebers Papyrus, and together they provide a stunningly detailed portrait of a medical system that was logical, methodical, and deeply practical. The story of their discovery is almost as dramatic as their contents. The Edwin Smith Papyrus, for instance, is named for the American dealer who purchased it in Luxor in 1862, but its origins are far older, dating to around 1600 B.C., though it is likely a copy of texts composed centuries earlier, from the very age of the pyramids. The Ebers Papyrus was purchased by the German Egyptologist Georg Ebers in 1873 and is even more extensive, a vast encyclopedia of medical knowledge from about 1550 B.C. What makes these documents so revolutionary is their structure. They are not random collections of spells and odd recipes. They are meticulously organized, following a consistent formula that any modern doctor would recognize: examination, diagnosis, prognosis, and treatment. The Edwin Smith Papyrus deals almost exclusively with trauma, the kinds of injuries a worker might suffer falling from a building site or a soldier might sustain in battle. For each of the 48 cases it presents, it begins with a title such as "Instructions concerning a gaping wound in his head, penetrating to the bone." Then comes the examination. The text instructs the physician to say, "Have him tell me what is wrong," listening to the patient's own account. Then, the physician is to perform a hands-on assessment. You should palpate his wound, feeling for the edges of the bone, testing for a crack or a fracture. This is clinical observation at its purest. The next step is the prognosis, and here the papyrus reveals a strikingly honest and scientific mindset. Each case is classified into one of three categories: an ailment which I will treat, an ailment which I will contend with, or an ailment not to be treated. This triage system shows a profound understanding of the limits of medicine. The physician was expected to recognize when an injury was fatal and to avoid futile interventions that would only waste resources and damage his reputation. For a severe spinal injury that resulted in paralysis, the text chillingly but accurately concludes, an ailment not to be treated. This is not an admission of magical failure. It is a sober, empirical assessment based on observed outcomes. Finally, the papyrus prescribes the treatment. For a dislocated jaw, it provides what is essentially the world's first documented physical therapy maneuver, instructing the physician to place his thumbs inside the patient's mouth while gripping the jaw from the outside to reposition it. The treatments are rational and direct, focusing on cleaning wounds with honey, a powerful natural antiseptic, and bandaging them with fresh meat on the first day to reduce swelling, followed by strips of linen and ointments. There are no appeals to deities in this papyrus. The approach is relentlessly pragmatic. The Ebers Papyrus, by contrast, is a much broader work, covering internal diseases, digestive problems, skin conditions, and even psychological issues. It contains over 700 remedies and prescriptions, from using castor oil as a laxative to a test for pregnancy involving barley and emmer wheat. While it does include more incantations alongside its practical recipes, showing the blend of science and belief, the sheer volume of herbal and mineral-based treatments points to an extensive and sophisticated understanding of pharmacology. These papyri are not mere curiosities. They are the hard evidence that Egyptian medicine was a true discipline, a system built on careful observation, logical classification, and a relentless pursuit of practical solutions to human suffering. This level of organization, so clearly documented in the papyri, points to an even more staggering reality. Ancient Egypt had the world's first known medical specialists. We are not talking about a single village healer who treated every conceivable ailment. Instead, Egyptian society supported a structured medical profession with distinct job titles, a concept that would not become standard in the Western world for thousands of years. The general practitioner was known as a SW&W, a word often depicted with the hieroglyphs for a lancelet, a roll of papyrus, and a pot of ointment, the essential tools of his trade. But beneath this general title existed a remarkable array of experts focused on specific parts of the body. Imagine suffering from a severe toothache in the time of the pharaohs. You wouldn't go to just any doctor. You would seek out an ayao, a dedicated dentist. Archaeological evidence confirms their work, from mummies found with teeth drilled to drain abscesses, to intricate bridges that used gold wire to bind replacement teeth made from ivory or even another human's tooth. For more internal complaints, you might consult a Neru Pehad, a specialist in intestinal diseases who would have possessed a deep knowledge of herbal remedies for digestive troubles. And perhaps most famously and humorously to the modern ear, there was the Shepherd of the Anus, a title that leaves little to the imagination about his area of expertise. This was essentially a proctologist, a doctor who dealt with ailments that, while often the subject of jokes today, were matters of serious and debilitating pain. The existence of such a specific role demonstrates a sophisticated understanding that different parts of the body required dedicated knowledge and techniques. This specialization allowed physicians to develop deep expertise, honing their skills on a narrower range of conditions rather than spreading their knowledge thin across the entire spectrum of human illness. One of the most critical and respected specializations was held by the priests of Sekhmet. Sekhmet was the powerful lion-headed goddess of pestilence and healing, a deity of terrifying duality. Her priests were the officials tasked with managing public health crises, particularly epidemics. In an age before germ theory, They interpreted outbreaks as the wrath of the goddess, but their response was far from purely mystical. They were, in effect, the ancient world's epidemiologists. They would have been responsible for quarantining the sick, performing rituals of purification that likely had practical hygienic benefits, and administering treatments on a massive scale. Their role combined spiritual authority with public health administration, showing that the Egyptians understood that some medical threats required a coordinated, society-wide response. This system of specialization reveals a medical culture that was not just advanced in its techniques, but also in its very structure. It was a profession built on the principle that focused expertise leads to better outcomes, a cornerstone of modern medicine that was already in place along the Nile millennia ago. But this sophisticated medical framework, with its specialized doctors and detailed papyrus records, raises a profound question: where did this intimate knowledge of the human body come from? It is a common assumption that the Egyptians learned everything from the practice of mummification, that their anatomical expertise was a byproduct of their elaborate burial rituals. While embalming certainly provided some insights, this explanation is surprisingly incomplete. The primary goal of mummification was not scientific dissection to understand function, it was a religious act of preservation for the afterlife. The internal organs were often removed carefully but as whole units, treated with preservatives, and placed in canopic jars, not meticulously dissected to study the intricacies of blood flow or nerve pathways. The true source of their practical anatomical knowledge was far more direct. It came from the daily, gritty reality of treating the living. The evidence for this is woven throughout the medical texts themselves, particularly in the Edwin Smith Papyrus, which is essentially a surgical manual for trauma. Imagine a physician treating a soldier with a deep gash on his shoulder from an axe. To clean the wound, stop the bleeding, and assess the damage, that doctor would have seen muscles, tendons, and bones firsthand. He would have observed how a severed blood vessel pulsed and spurted, directly linking the flow of liquid to the rhythmic beating felt elsewhere in the body. This hands-on experience with wounds and injuries provided a brutal but effective education in living anatomy. They developed a detailed vocabulary for body parts, with specific words for the skull, the collarbone, the vertebrae, and even different parts of the brain. They understood that damage to one side of the brain could cause paralysis on the opposite side of the body, a finding noted in the papyri that demonstrates incredibly sharp observation. Central to their understanding was the concept of the metu. This term is difficult to translate perfectly into modern English because it encompassed a wide range of tubular structures within the body. The metu included what we would call blood vessels, tendons, ligaments, and even nerves and muscles. The Egyptians correctly identified that these channels served as conduits, carrying vital substances throughout the body. They believed the heart was the central hub of this entire system, describing it as the place from which the metu reached every limb. This was a functional, if not entirely precise, understanding of the circulatory system. They even developed a practical method for assessing a patient's condition by feeling the pulse at various points, not to count beats per minute as we do, but to gauge the strength and quality of the flow within these metu. A weak pulse in the arm or leg could indicate a blockage or a systemic illness, a diagnostic technique born from empirical observation rather than mystical belief. Their knowledge of the heart's importance was particularly profound. Long before the Greeks formalized the idea, Egyptian physicians saw the heart as the core of a person's being, the source of intelligence, emotion, and life itself. While they attributed mental and spiritual functions to the heart that we now assign to the brain, their physiological insight was remarkably accurate. They documented the heart's connection to the entire body through the metu, understanding its role as a pump that distributed something essential. They even had a specific word, wehayu, for the regular, rhythmic beating that could be felt at the wrists and the temples. This wasn't just a vague notion, it was a recognized, diagnosable sign of life. This practical anatomical knowledge, gained from the battlefield, the construction site, and the surgical table, formed the bedrock upon which their entire medical system was built. It allowed them to move beyond superstition and develop treatments based on a logical, if incomplete, model of how the human body actually worked. While their hands-on experience provided a practical understanding of anatomy, the Egyptians also developed a comprehensive theoretical framework to explain health and sickness, a system centered on the vital concept of the metu. Think of the human body not as a collection of separate organs, but as a complex, irrigated garden. The metu were the canals, a vast and intricate network of channels that carried the essential fluids and forces of life to every single part of the organism. This was not a simple concept. The metu were understood to carry far more than just blood. They were the pathways for air, which was drawn into the body through the nose and distributed to the limbs. They transported water, mucus, tears, and urine. They even served as conduits for a person's life force, a spiritual energy that animated the flesh. In this holistic view, the body's well-being was entirely dependent on the free and unimpeded flow of these substances through the metu. Disease, therefore, was not seen as an invasion by evil spirits, though that belief coexisted, but most commonly as a physical malfunction within this hydraulic system. The primary causes of illness were understood to be blockages and putrefaction. Imagine a key irrigation canal in that garden becoming clogged with silt. The land downstream would wither and die. The Egyptian physician applied the same logic. If a metu became blocked, perhaps by a substance they called wehidu, which could be thought of as a kind of decaying or morbid matter, the flow of life-giving substances would be cut off. A blockage in a metu leading to a limb could cause paralysis or numbness. A buildup in the channels associated with the digestive system could lead to pain, swelling, and a failure to process food. The other great threat was putrefaction, the idea that substances trapped within these channels could rot and ferment, producing toxins that would then spread throughout the body, causing fever, pus, and a general state of decay. This was a remarkably logical explanation for the observable symptoms of infection. This sophisticated theory directly informed their diagnostic and treatment strategies. A physician would carefully question and examine a patient, searching for clues about which metu were affected and why. They developed a technique of feeling the pulse at various points on the body, the wrists, the neck, behind the knees, not to count heartbeats as we do, but to assess the quality of the flow within the vessels. A weak or erratic pulse suggested a partial blockage or a weakness in the heart's pumping action. Swelling in a specific area pointed to a local backup in the fluid-carrying channels. By piecing together these clues, the doctor could form a diagnosis based on this internal hydraulic model. Treatments were then designed to restore the proper flow. This is where many of their most effective remedies come into focus. They used strong emetics and laxatives, not to punish the patient, but to forcibly clear out blockages in the gastrointestinal metu. Diuretics were administered to increase the flow of urine and flush out the renal channels. Even the widespread use of enemas fits perfectly within this framework. The Egyptians were famous for their regular use of cleansing clysters, believing that the colon was a major repository for the wehidu, the decaying matter that could cause systemic illness if not regularly evacuated. This practice was so ingrained that the god Thoth was sometimes credited with inventing the enema. While this might seem extreme or comical today, it was a rational response to their physiological model. They were essentially performing preventative maintenance on the body's plumbing. The logic is undeniable. If disease is a blockage, then the cure is to restore the flow. While their understanding of the specific substances flowing through the metu was different from our knowledge of blood cells, hormones, and nerve impulses, the underlying principle that health depends on clear communication and transportation within the body is a cornerstone of physiology that remains profoundly relevant even in our modern age. Armed with this sophisticated theory of the body as a network of channels, the Egyptian physician's next step was to apply it with remarkable clinical skill. The diagnostic methods they employed, as detailed in the papyri, reveal a process that feels strikingly familiar to any modern doctor-patient interaction. It was a meticulous, multi-layered investigation that began not with assumptions, but with careful observation. The Edwin Smith Papyrus provides the clearest window into this methodical approach. For each traumatic injury, the text instructs the healer to begin with a simple but profound command: have him tell me what is wrong. This initial step, the patient's own account of their pain and how the injury occurred, was the foundation of the diagnosis. It established a partnership between healer and patient, gathering crucial contextual clues that guided the physical examination to come. Following the patient's story, the physician would then perform a hands-on assessment, a practice known as palpation. The papyrus is filled with specific instructions like, "You should palpate his wound." This was not a cursory glance, it was a deliberate exploration with the fingertips. The physician would feel for the edges of a broken bone beneath the skin, testing for instability or the grating sensation of bone fragments. They would gently probe a head wound to determine if the skull was merely fractured or actually shattered, a critical distinction that dictated the prognosis and treatment. They learned to recognize the feel of swelling caused by a simple bruise versus the more ominous tension of an internal hematoma. This tactile investigation allowed them to build a mental map of the damage hidden beneath the surface, translating physical sensations into a clinical understanding of the injury's severity. But their diagnostic acumen extended far beyond trauma. Egyptian doctors were masters of observing the body's external outputs for clues about internal health. They conducted detailed inspections of a patient's excretions, urine, stool, sweat, and even vomit. They looked for changes in color, consistency, and odor, understanding that these wastes were the end products of the body's internal metabolic processes. Abnormalities in these substances were clear indicators that something was amiss within the metu system. For instance, the presence of blood in urine might suggest a blockage or injury in the renal channels, while certain changes in stool could point to a putrefactive process in the digestive tract. This practice of uroscopy, analyzing urine, would remain a cornerstone of medical diagnosis for thousands of years, and the Egyptians were its pioneering practitioners. Perhaps one of their most advanced diagnostic techniques was their assessment of the pulse. While they did not count heartbeats per minute as we do, they developed a sophisticated qualitative analysis of the pulse wave. The physician would place his fingers on the patient's wrist, the neck, or even behind the knees, feeling the rhythm and strength of the pulse at these different points. They had specific terms for a pulse that was strong, weak, rapid, or irregular. A feeble pulse in a limb could indicate a partial blockage in the metu supplying that area, much like a kink in a garden hose reduces water pressure. A pulse that was erratic or pounding might signal a fever or a systemic imbalance. This was a direct application of their hydraulic model of the body. By checking the pressure at various access points, they could diagnose where the flow of life-giving substances was compromised. This systematic approach, listening to the patient, palpating the injury, inspecting excretions, and feeling the pulse, created a comprehensive picture of the patient's ailment. It was a logical, evidence-based process that sought physical causes for physical symptoms, moving Egyptian medicine light years beyond mere guesswork and into the realm of true clinical science. With such a sophisticated understanding of the body's inner workings, it stands to reason that Egyptian physicians would possess an equally advanced toolkit for treatment. And they did not disappoint. Their pharmacopoeia was nothing short of a vast natural pharmacy, a comprehensive collection of remedies drawn from the plants, minerals, and animals of their environment. What is truly staggering is not just the breadth of ingredients they used, but the profound, almost intuitive understanding they had of their biochemical properties long before the science of chemistry even existed. They weren't just mixing random herbs, they were applying specific substances whose therapeutic effects have been confirmed by modern science. Take honey, for example. It appears in countless prescriptions within the Ebers Papyrus, most commonly as a primary ingredient in wound dressings. The Egyptians recognized that applying honey to an open cut or burn would prevent it from festering and speed up healing. We now know exactly why this works so well. Honey is a powerful natural antibiotic. Its high sugar content creates an osmotic environment that draws moisture out of bacterial cells, effectively dehydrating and killing them. It also contains an enzyme called glucose oxidase, which produces small amounts of hydrogen peroxide, a well-known antiseptic. Furthermore, honey forms a protective barrier over a wound, keeping it clean and moist. This wasn't just a lucky guess, it was an empirically proven therapy that saved countless lives from infection. Another brilliant example is their use of willow bark. There are prescriptions for chewing on willow bark or brewing it into a tea to relieve pain and reduce fevers. The active compound in willow bark is salicin, which the human liver converts into salicylic acid. This is the direct chemical precursor to acetylsalicylic acid, which we know today as aspirin. While they didn't isolate the pure compound, they had identified the natural source of one of the world's most important pain-relieving and anti-inflammatory drugs. Garlic was another staple. It was fed to laborers building the pyramids, arguably as a performance enhancer, but more likely for its recognized health benefits. Garlic possesses potent antimicrobial and antifungal properties thanks to a compound called allicin, making it an effective internal agent for fighting infections. Their knowledge extended even to the microscopic world. They used yeast, often from brewing beer, to treat skin infections and digestive ailments. Applying a yeast poultice to a wound introduces beneficial fungi that can outcompete harmful bacteria, a primitive form of probiotic therapy. They also utilized minerals with great skill. Malachite, a green copper ore, was ground into a powder and applied to the eyes to treat infections. Copper salts are indeed antibacterial, and this practice may have been genuinely effective against conditions like trachoma. They used salt for its cleansing and drying properties, natron as a drying agent, and even lead-based cosmetics, which, while toxic in the long term, had mild antibacterial qualities that may have provided short-term relief for skin conditions. But the true mark of their sophistication lies not just in what they used, but in how they prepared and administered these substances. They were masters of pharmaceutical formulation. Remedies were rarely given as a single, raw ingredient. Instead, they were meticulously compounded into a variety of delivery methods that would be familiar in any modern pharmacy. Ointments were created by mixing crushed herbs or minerals with fats like animal lard or vegetable oils to create a salve that could be spread over the skin. Pills were fashioned by combining powdered ingredients with dough or honey to form a swallowable bolus. For respiratory issues, they devised inhalations. Instructions exist for heating certain resins on a hot brick and having the patient breathe in the medicated steam. They even created suppositories, using molds to shape medicated fats for insertion into the rectum or vagina to treat localized ailments. This demonstrates an incredible practical understanding of how to get a medicine to the specific part of the body where it was needed most. They weren't just herb collectors, They were the ancient world's first expert chemists and pharmacists, transforming raw materials into sophisticated, targeted medical treatments. Perhaps the most undeniable proof of their medical courage, however, lies in their willingness to perform one of the most audacious operations imaginable: surgery on the human skull, a procedure known as trepanation. The very thought of it sends a shiver down the spine, the deliberate drilling or scraping of a hole into the living cranium. For centuries, this was considered a desperate act of primitive magic, but the Egyptian evidence tells a far more scientific story. We have recovered skulls, like one dating back to nearly 2500 BCE, that show a clean, rectangular opening cut into the bone, but the truly astonishing part is not the hole itself, it is the signs of healing, the smooth, rounded edges of new bone growth that had begun to form over the incision site. This is the unmistakable signature of survival. The patient did not just undergo the procedure, they lived for months, even years afterward. This was not a reckless gamble. The Edwin Smith Papyrus describes such injuries, noting that a comminuted fracture, where the skull is crushed, was often deemed untreatable, but a simpler fracture could be addressed. The act of trepanation was likely a calculated intervention to relieve pressure on the brain caused by a traumatic injury, a last-ditch effort to save a life that, against all odds, sometimes succeeded. These healed skulls stand as silent, powerful monuments to the skill and bravery of surgeons who operated with flint and copper, yet achieved outcomes that would challenge physicians for millennia to come. But this remarkable medical prowess wasn't limited to the grand theater of brain surgery or the internal mysteries of the metu. It extended to a part of the body that affected nearly every Egyptian, from pharaoh to peasant: the mouth. Life along the Nile, for all its agricultural abundance, presented a unique and relentless challenge to dental health. The staple of the Egyptian diet was bread, consumed in vast quantities by everyone. But this wasn't the soft, refined bread we know today. It was coarse, ground using stone querns and mortars. This process inevitably introduced tiny, abrasive particles of sand and stone dust into the flour. Every single loaf was, in effect, a gentle but persistent file, slowly wearing down the tooth enamel with every bite. Over a lifetime, this constant abrasion would erode the protective layer of the teeth, exposing the sensitive dentin underneath and creating pathways for devastating cavities and abscesses. Archaeologists examining mummies find this pattern etched into their remains, teeth worn down to the gum line, often with severe decay at the roots. Yet, faced with this unavoidable dietary curse, the Egyptians did not simply resign themselves to a future of pain and tooth loss. They fought back with a sophisticated approach to dentistry that went far beyond simple extractions. We have direct evidence from mummies themselves that proves they were performing what can only be described as early dental surgery. One remarkable mummy was found with a tooth that had been meticulously drilled. The hole was not for decoration, it was drilled directly into the side of a molar, creating a drainage channel for a painful abscess that had built up at the root. This was a deliberate, therapeutic procedure designed to relieve pressure and save the tooth, a clear sign of intervention aimed at preservation, not just removal. Their ingenuity extended even further into the realm of restorative dentistry. We have discovered mummies with sophisticated dental bridges. In one famous case, a bridge was created by drilling a small hole through two healthy teeth on either side of a gap. A gold wire was then threaded through these holes, lashing a replacement false tooth carved from ivory or sometimes even another human tooth into place. This wasn't a mere cosmetic trick, it was a functional prosthetic designed to restore the ability to chew properly. They even developed early forms of fillings. Analyses of some mummified teeth have revealed cavities that were packed with a protective substance, likely a resinous paste or a mixture containing linen, intended to seal the cavity and halt decay. These are not the actions of a culture that viewed teeth as disposable. They demonstrate a clear desire to repair, to maintain, and to restore function. This practical approach is mirrored in their medical texts, which contain specific recipes for treating oral ailments. The Ebers Papyrus includes several prescriptions for remedies to strengthen a tooth. One such recipe involves a mixture of ground ochre, honey, and other ingredients, which would be applied to the gums and teeth. While some remedies included magical incantations, many were straightforward, practical formulations. They used herbs like celery and fenugreek, known for their anti-inflammatory properties, to create mouthwashes and poultices to soothe inflamed gums. For the searing pain of a toothache, they had numbing agents. They would create a paste from a plant called henbane, a member of the nightshade family that contains natural sedative and pain-killing compounds similar to those used in modern anesthetics. A small ball of this paste placed against the aching tooth or gum would have provided genuine, if temporary, relief. This combination of surgical intervention, prosthetic innovation, and targeted pharmacology reveals a society that treated oral health with the same seriousness and sophistication as any other branch of medicine. They recognized that a healthy mouth was integral to overall well-being, and they deployed every tool at their disposal to combat the very real pain that was baked into their daily bread. This commitment to restoring the human body extended far beyond the mouth and into a realm that seems astonishingly modern: the creation of functional prosthetic limbs. While we might think of artificial limbs as a product of contemporary medicine, the ancient Egyptians were pioneers in this field as well, designing devices not merely for symbolic burial rites, but for active, practical use in daily life. The most compelling evidence for this is an object of simple, elegant genius, the Cairo toe, discovered attached to the foot of a mummy dating from between 900 and 600 BCE. This prosthetic is a detailed recreation of a human big toe, meticulously carved from wood and fastened to the foot with a series of leather straps. What makes this artifact so revolutionary is not its existence, but the story told by its physical condition. The toe shows clear, polished wear patterns on its underside, exactly where a big toe would naturally flex and make contact with the ground while walking. This is not the pristine state of an object created for a one-time funeral. It is the weathered, lived-in appearance of a tool that was used day in and day out for years. For its elderly female owner, who is missing her own big toe, likely due to diabetes or trauma, this wooden replacement was a vital piece of medical technology. It would have restored her balance and gait, allowing her to walk comfortably without a severe limp, a critical function in a society where mobility was essential. The sophistication of the Cairo toe is further highlighted by its design, which reveals a deep understanding of biomechanics. The artisans who created it, likely working in close consultation with physicians, incorporated a beveled edge and a hinge-like structure that allowed for a more natural range of motion. It wasn't a rigid block of wood, it was engineered to mimic the flexion of a real joint. This demonstrates an appreciation for the functional role of the big toe in propelling the body forward. Losing it would have been a significant disability, making walking painful and unstable. The prosthetic directly addressed this mechanical problem, proving that Egyptian medical thought was focused on holistic quality of life, not just survival. Other examples support this conclusion. Another famous prosthetic, the Greville Chester toe, made from cartonnage, a sort of papier-mâché using linen and plaster, is also shaped with careful anatomical accuracy, designed to fit comfortably on the residual tissue. These devices show a level of empathy and practical problem solving that transcends time. They were custom-fitted solutions for individuals, crafted to alleviate a specific physical hardship and restore a person's dignity and independence. This evidence fundamentally challenges the long-held assumption that any object found on a mummy was purely ceremonial, placed there to ensure the deceased was whole for the afterlife. While the spiritual belief in physical completeness was undoubtedly powerful, the practical wear on the Cairo toe forces us to reconsider. It suggests a culture that saw no contradiction between the spiritual and the practical. Why would you not provide a functional prosthetic to a living person when that same device could then accompany them into eternity, serving both an immediate worldly need and a profound religious purpose? This dual-use thinking is a hallmark of Egyptian medicine. A dental bridge allowed its owner to eat properly in life and be whole in death. A prosthetic toe enabled mobility on earth and completeness in the afterlife. This holistic approach treated the patient as an entire being, whose physical comfort and social functionality were just as important as their spiritual preparedness. The careful craftsmanship of these early prosthetics stands as a powerful, silent testament to the depth of Egyptian medical ingenuity, revealing a society that valued human dignity enough to engineer solutions for living with disability over 2,500 years ago. All this remarkable medical innovation, from dentistry to surgery, would have meant very little if it only served a privileged few. The true genius of the Egyptian system, and a key reason for its enduring success, was its application on a massive, societal scale. The Egyptians developed one of the world's first comprehensive approaches to public health, built on a foundation that seems almost modern in its logic: the connection between cleanliness and well-being. They understood that preventing illness was just as important as curing it, and this philosophy was woven into the very fabric of daily life, from the pharaoh's palace to the humblest mud brick home. Their concept of cleanliness was not merely about appearing presentable, it was a form of practical, spiritual, and medical purification, a vital defense against the invisible forces of decay and disease that they understood as wehidu. This societal obsession with hygiene was a powerful contributing factor to the civilization's incredible stability, allowing it to flourish for 3,000 years. The cornerstone of this system was water. The Nile provided an abundant supply, and the Egyptians made full use of it for both ritual and practical cleansing. Multiple times a day, individuals were expected to wash their hands, face, and body. For the wealthy, this meant elaborate bathrooms within their homes, with stone slabs for washing and channels to drain the water away. For the common laborer, it meant a thorough rinse in the river or from a water jar before meals and after work. This was not a casual splash of water. They used a cleansing agent called natron, a remarkable natural salt harvested from the dried beds of desert lakes. Natron is a mixture of sodium carbonate, sodium bicarbonate, and sodium chloride, essentially a primitive but highly effective soap. When mixed with water, it creates an alkaline solution that cuts through grease and grime, but its power went far beyond simple cleaning. The Egyptians, through their embalming practices, knew that natron was a powerful desiccant, drawing all the moisture out of organic tissue and preventing rot. They correctly deduced that what prevented decay in a corpse could also prevent putrefaction, the growth of harmful agents, on living skin. By washing with natron, they were not just removing visible dirt, they were disinfecting themselves, creating a hostile environment for the bacteria and parasites that caused so much disease. This knowledge was applied with particular rigor to food preparation. Butchers and cooks were expected to maintain scrupulous cleanliness. There are instructions in various texts for washing the hands thoroughly before handling food, for scouring pots and utensils, and for ensuring that meat was cooked properly. They understood that spoiled food could cause severe intestinal distress, which they would have interpreted as a blockage or putrefaction within the metu of the digestive system. Their solution was a preventative one, meticulous hygiene to stop the problem at its source. This attention to sanitation extended to the community level. Archaeologists have uncovered evidence of sophisticated waste management in workers' villages, like the one at Deir el-Medina, home to the artisans who built the royal tombs in the Valley of the Kings. These settlements featured dedicated areas for waste disposal and, in some cases, what appear to be primitive latrines, holes in the ground with a pottery seat, often situated away from living and cooking areas. This separation of clean and unclean spaces demonstrates a clear, practical understanding of how to minimize the spread of illness within a dense population. Perhaps the most striking example of their public health foresight was their management of the dead. While the elaborate process of mummification was reserved for the elite, even commoners were buried with some degree of ritual preparation, which always involved washing and purification. This practice had a direct and beneficial public health outcome by carefully handling and relatively quickly interring the deceased, especially in the hot Egyptian climate. They were effectively containing the spread of pathogens that flourish in decaying bodies. The priests of Sekhmet, those specialists in managing plagues, would have been the officials overseeing these protocols during times of epidemic, acting as a combination of spiritual guide and public health officer. They would enforce quarantines and perform purification rituals that, while framed in religious terms, involved fumigation with pleasant-smelling resins and herbs, a practice that would have had a mild antiseptic effect in the air. This society-wide, integrated approach to hygiene, from the individual's daily wash to the community's waste management, created a baseline of health that was unprecedented in the ancient world. It reduced the overall disease burden, allowing physicians to focus on traumatic injuries and specific ailments rather than constantly battling widespread epidemics. This proactive, preventative mindset, recognizing that the health of the individual is inextricably linked to the cleanliness of the community, is a public health principle we still champion today, and the Egyptians were its pioneering architects. Yet this wealth of medical knowledge finds its most powerful expression in a single, extraordinary document, the Edwin Smith Papyrus. If we could step into the mind of an ancient Egyptian physician, this papyrus would be our guide. It is arguably the most important medical text to survive from the ancient world, not for its length or its magical recipes, but for its stunningly rational and systematic approach. Unlike other papyri that blend medicine with magic, the Smith Papyrus reads like a modern surgical textbook, devoted entirely to the diagnosis and treatment of traumatic injuries. Its organization is methodical and logical, beginning with injuries to the head and working its way down the body to the spine. Each of its 48 cases is presented with a clarity and consistency that reveals a highly developed scientific mindset. The text doesn't just list cures, it teaches a process. For every injury, the papyrus follows the same rigorous formula, a 4-step method that any modern doctor would instantly recognize: examination, diagnosis, prognosis, and treatment. The process begins with a title, a straightforward description of the problem like instructions concerning a smash in his skull. Then comes the examination. The physician is instructed to start by listening, have him tell me what is wrong. This simple command establishes the patient's own account as the foundational evidence. Next, the hands-on investigation begins. The text directs the healer to palpate the wound, to feel for a crack in the bone, to check for a discharge from the nose or ears that might indicate a deeper cranial fracture, and to ask the patient to perform simple movements, like looking at his own shoulders, to test for neurological damage. This is clinical observation at its purest, a far cry from divination or dream interpretation. It is in the third step, the prognosis, that the papyrus reveals its most remarkable and sobering feature. After assessing the injury, the physician is instructed to classify it into one of three distinct categories, a system of medical triage that demonstrates a profound understanding of their own limitations. The first and most hopeful category is an ailment which I will treat. This is assigned to injuries where the physician is confident of a successful outcome, such as a simple flesh wound or a non-displaced fracture. The second category, an ailment which I will contend with, is more cautious. This is for serious but not necessarily fatal injuries where the outcome is uncertain. The physician will attempt treatment, but he is essentially hedging his bets, acknowledging the possibility of failure. This honest assessment protected his reputation while still offering hope. The final category, however, is where the text's stark realism truly shines, an ailment not to be treated. This verdict is delivered for injuries that are clearly beyond any hope of remedy. A classic example is a crushing injury to the vertebrae that results in paralysis below the site of the break. The papyrus describes the symptoms with chilling accuracy. The patient cannot control his legs, he is incontinent, and he may have lost sensation. For such a case, the text offers no magical spell or futile potion. It simply states the grim reality and instructs the physician not to intervene. This is not a sign of weakness or ignorance, it is the ultimate sign of a mature medical science. It shows that these physicians had observed countless patients and understood that some conditions were universally fatal. To attempt a cure would be to offer false hope, waste precious resources, and damage the healer's credibility. This triage system forced a brutal but necessary honesty, focusing effort where it could actually make a difference. The treatments prescribed for the cases deemed treatable are equally rational and direct. For a gaping wound, the instructions are to clean it, bring the edges together, and apply a dressing of fresh meat on the first day to reduce swelling, followed by bandages soaked in honey and grease on subsequent days. The honey, as we now know, acts as a powerful natural antibiotic, while the grease and bandages protect the wound. For a dislocated jaw, the papyrus provides a detailed, step-by-step guide for reduction. The physician is to place his thumbs inside the patient's mouth on the lower molars while gripping the jaw from the outside and gently manipulate it back into place. What is almost entirely absent from this papyrus is any appeal to the gods. There are no incantations to Isis or spells to drive out demons. The approach is relentlessly physical, relying on observation, logic, and practical intervention. The Edwin Smith papyrus stands as a monumental achievement, a clear window into a world where science, not superstition, guided the healer's hand, and where the cold, hard facts of human anatomy were faced with unflinching courage. If the Edwin Smith papyrus represents the sharp, focused scalpel of Egyptian medicine, then the Ebers papyrus is its entire, sprawling pharmacy. Where the Smith text is a concise surgical manual for trauma, the Ebers is a vast encyclopedia of internal suffering, a sprawling scroll that attempts to catalog and cure every ailment imaginable. This document, stretching over 20 meters in length, is the single most comprehensive medical text we have from the ancient world. It moves from the external battlefield of wounds into the complex, hidden landscape of the human interior, covering everything from heart disease and digestive troubles to gynecology, dermatology, and even psychiatry. It presents a medical world that is both brilliantly rational and deeply mystical, a system that saw no contradiction between a herbal poultice and a sacred incantation. This duality is not a sign of confusion, but rather the key to understanding the Egyptian mind, a holistic view where the physical and the spiritual were two sides of the same life force. The sheer scope of the Ebers papyrus is breathtaking. It opens with a magnificent claim, a revelation from the gods themselves, establishing its authority. Then it launches into a systematic exploration of the body, often organized around the familiar concept of the metu, those vital channels. It contains over 700 prescriptions and nearly 100 anatomical terms, reflecting an immense body of accumulated knowledge. One of its most famous sections is dedicated to the heart, which it describes with striking accuracy as the center of a network of vessels that reach every part of the body. It even details symptoms of cardiac conditions like palpitations and weakness, showing a keen clinical eye for cardiovascular illness, but it doesn't stop there. It offers detailed remedies for constipation using castor oil, treatments for asthma involving inhaling steam from herbs, and even what might be the world's first recorded pregnancy test. This test involved a woman urinating on separate bags of barley and emmer wheat. If the barley sprouted, she was believed to be having a boy. If the emmer wheat sprouted, a girl. While the gender determination was likely superstition, modern experiments have shown that the urine of a pregnant woman, rich in estrogen, can indeed promote germination, suggesting an accidental discovery of a real biochemical effect. Where the Edwin Smith papyrus is almost sterile in its practicality, the Ebers reveals the other, more spiritual dimension of Egyptian healing. Here, rational recipes for salves and potions often exist side by side with powerful incantations meant to drive away the demons of disease. A prescription for a headache might include a remedy of poppy seed to dull the pain, but it might also be accompanied by a spell invoking the god Horus to banish the evil spirit causing the pressure in the skull. This blend can seem jarring to a modern audience, but to the Egyptians, it was perfectly logical. They believed that illness could have two causes, a physical one, like a blockage in the metu, or a spiritual one, like the wrath of a god or the curse of an enemy. Therefore, a complete treatment had to address both possibilities. The medicine healed the body, while the spell protected the spirit. A physician was not just a mechanic for the human machine, he was a priest for the soul within it. This dual approach is perhaps most evident in their treatments for what we would recognize today as mental health issues. The Ebers Papyrus describes a condition called WH, often translated as fever of the heart, which manifested as sadness, lethargy, and a withdrawal from society symptoms we would associate with depression. The recommended treatments were holistic. They included physical interventions like soothing massage with fragrant oils and baths aimed at relaxing the body. But they also involved what we might call talk therapy or environmental therapy. The patient was encouraged to walk in pleasant gardens, listen to music, and be surrounded by beautiful things. The underlying philosophy was to restore harmony to the entire person, acknowledging that a distressed mind could manifest in a sick body and vice versa. This integrated view of health, treating the patient as a whole being rather than just a collection of symptoms, is a concept that modern medicine is only recently beginning to fully embrace again, a testament to the profound wisdom contained within this ancient, fragile scroll. Yet to truly appreciate Egyptian medicine, we must confront what seems, to our modern eyes, its greatest contradiction: the pervasive presence of magic and religion intertwined with such rational science. It is tempting to dismiss the incantations to Sekhmet or the spells invoking Isis as primitive superstition, a flawed layer obscuring their genuine achievements. But this view misunderstands the Egyptian world view entirely. For them, magic and medicine were not opposing forces, they were complementary strands woven into a single, unified system for healing. The physician did not see a choice between a bandage and a blessing. He saw a patient whose suffering could spring from a physical wound or a spiritual affliction, and often from both simultaneously. A broken leg was a clear mechanical failure, but the infection that set in afterwards could be interpreted as the work of a malevolent spirit or the displeasure of a god. Therefore, a comprehensive treatment had to address both realms. The honey poultice fought the physical decay, while the spoken spell created a spiritual barrier against the forces of putrefaction. This integration served a profoundly practical, psychological purpose. Imagine yourself as an anxious patient in ancient Egypt, facing a painful procedure or a debilitating illness. The healer arrives not just with his box of knives and herbs, but with the authority of the gods themselves. Before applying a dressing, he recites a powerful incantation, perhaps one that calls upon the lion-headed goddess Sekhmet, the very deity who could send plagues but also held the power to cure them. This ritual was not empty theater. It was a carefully staged intervention designed to inspire confidence and calm the patient's mind. In an age without anesthesia or a deep understanding of physiology, fear itself could be a lethal complication. The recitation of a sacred text, the burning of aromatic resins, the presence of amulets, all of these elements worked to create an atmosphere of controlled power and divine favor. They reassured the patient that they were in the hands of someone who could command unseen forces, thereby reducing anxiety and potentially improving the body's own ability to heal. It was a primitive form of placebo effect, harnessed intentionally to maximize the efficacy of the physical treatment. The healer himself was empowered by this fusion of roles. As a SW&W, or physician, he possessed practical skill, but by also acting as a priest or magician, he tapped into a source of authority that transcended his human limitations. This was crucial for his own confidence when facing a difficult case, believing that he had the support of Thoth, the god of wisdom, or Isis, the great magician, gave him the courage to attempt a risky surgery or to stand firm when a plague swept through a village. The rituals were as much for the doctor as for the patient, a psychological armor against the immense pressure of his profession. This dual identity also protected him in the event of failure. If a patient died despite his best efforts, he could attribute the outcome to a divine will that was beyond his power to change, thus preserving his social standing and allowing him to continue practicing. The integrated system of magic, religion, and medicine was not a sign of confusion, but a sophisticated, holistic approach to the immense challenge of healing. It treated the human being as an inseparable union of body, mind, and spirit, acknowledging that to cure one, you often had to attend to all. This sophisticated understanding of the human body, which blended the physical and the spiritual so effectively, found one of its most remarkable expressions in the care dedicated specifically to women. Far from being neglected, women's health was a major focus for Egyptian physicians, who developed an entire branch of medicine for gynecology and obstetrics that was centuries ahead of its time. They recognized that female physiology presented unique challenges and opportunities, and their approach was both practical and surprisingly insightful. The most famous example, preserved in the Ebers Papyrus, is a test for pregnancy that seems to border on magic but may have a basis in biochemical reality. The test instructed a woman to urinate daily on bags of barley and emmer wheat. If either grain sprouted, it indicated she was pregnant. If the barley grew first, it predicted a male child, while the emmer wheat foretold a girl. While the gender prediction was almost certainly superstition, modern scientific experiments have yielded a fascinating result. The urine of pregnant women contains elevated levels of estrogen, a hormone that can indeed stimulate seed germination. The test, therefore, might have been a genuine, if accidental, early detection method for pregnancy, showcasing an empirical approach to observing natural phenomena long before the underlying science was understood. Beyond confirming pregnancy, Egyptian doctors sought to ensure its successful outcome, developing a range of treatments for common complaints and complications. They had remedies for morning sickness, for back pain, and for ensuring a good milk supply after birth. To encourage conception and address fertility issues, their pharmacopoeia was extensive. They prescribed a variety of herbal suppositories and potions, some of which contained plant-based estrogens that could have genuinely helped regulate a woman's cycle and improve the chances of pregnancy. One prescription involved fumigating the woman with the smoke of specific resins and oils, a practice that combined a likely soothing, aromatic therapy with a ritualistic element intended to open the womb to life. For difficult labor, they had methods to try and turn a breech baby and used substances like saltpeter, which can act as a muscle relaxant to ease contractions. This demonstrates a proactive approach to managing the entire process of childbirth, from conception to delivery. Their expertise extended to general gynecological health, treating conditions we would recognize today as infections, menstrual irregularities, and uterine prolapse. The Kahan Gynecological Papyrus, the oldest known medical text dedicated solely to women, is a fascinating document that systematically addresses these issues. It presents case after case, each following a logical structure. For a woman suffering from what is described as a aching in her vagina, the papyrus might prescribe a douche made from acacia leaves, which have natural astringent and anti-inflammatory properties. For excessive menstrual bleeding, a common and dangerous problem, they used remedies involving hemp or other herbs known to have a constricting effect on blood vessels. The treatments were often applied directly, using specially designed instruments like birthing bricks and vaginal speculums made from wood or bronze, which allowed for internal examinations. This dedicated focus on the specific health needs of women, with its blend of observed effectiveness and compassionate care, reveals a medical culture that valued the health of all its members, acknowledging the critical role women played in the very survival and prosperity of the society. This remarkable medical system, so finely tuned for human patients, did not stop at the edge of the Nile or the door of the physician's house. The ancient Egyptians extended their healing arts to the animal kingdom with a breadth of application that further underscores their empirical and pragmatic approach. Evidence from tomb reliefs, skeletal remains, and even specialized medical texts reveals that they practiced a sophisticated form of veterinary medicine, caring for everything from the oxen that plowed their fields to the beloved pets that shared their homes and the sacred animals revered in their temples. This wasn't a simple matter of folk remedies, it was the systematic application of the same principles of diagnosis, surgery, and pharmacology they used on people, demonstrating a holistic view of health that encompassed all creatures under their care. The economic engine of ancient Egypt ran on the strength of its livestock. Cattle were not merely a source of food, they were living capital, essential for plowing, threshing, and transport. An outbreak of disease in a herd could spell economic ruin for a landowner or even disrupt the food supply for a community. Consequently, the health of these animals was a matter of serious state concern. Tomb scenes from the Old Kingdom show officials inspecting cattle, and while no dedicated veterinary papyrus has survived intact, we can extrapolate their methods from human texts and archaeological finds. It is almost certain that the same treatments for wounds, fractures, and infections described in the Edwin Smith and Ebers papyri were adapted for use on animals. A deep gash on a bull's flank would be cleaned with honey and bandaged. A broken leg from a fall would be set with linen-wrapped splints. The logic was identical: prevent putrefaction, stabilize the injury, and promote natural healing. The Egyptians also understood parasites, both internal and external. They had treatments for worms in livestock, using purgatives like castor oil, and they developed insect-repellent ointments to protect animals from flies and ticks, mixtures that likely included aromatic oils like frankincense or myrrh. But the care they provided went far beyond mere economic utility. The Egyptians shared a deep, affectionate bond with their pets, particularly dogs and cats. Dog burials have been found with touching care, some with their leather collars still intact. One of the most poignant examples of veterinary intervention comes from a dog skeleton discovered at a site from the Ptolemaic period. The animal had suffered a severe compound fracture of its leg, a catastrophic injury that would have been excruciatingly painful and almost certainly fatal without help. Yet the bones tell a story not of abandonment, but of compassion. The fracture had been skillfully set and splinted. The clear signs of healing around the break indicate the dog lived for several weeks or months after the injury, being fed and cared for by its human family during its recovery. This was not an act driven by economic value, it was an act of love, a testament to the human-animal bond, and a willingness to apply advanced medical knowledge to ease the suffering of a cherished companion. The most extensive evidence of specialized animal medicine, however, comes from the realm of the sacred. The Egyptians practiced a form of animal worship that involved the intentional breeding, raising, and mummification of millions of creatures as votive offerings to specific deities. At vast catacombs, like those at Saqqara dedicated to the ibis-headed god Thoth, archaeologists have recovered millions of mummified ibises and baboons. Similarly, temples for the cat goddess Bastet saw the burial of countless feline mummies. The scale of these operations required what can only be described as industrial-scale animal husbandry and, inevitably, veterinary care. Examination of these mummies has revealed extraordinary evidence of medical practice. Ibises have been found with splints on their fractured legs, carefully applied with resin-soaked linen, identical to the technique used for human fractures. Some of these birds show signs of having lived for a significant time after the injury, meaning they were kept alive and fed within the temple precincts until their natural death or selected for mummification. Even more startling are the discoveries related to sacred bulls, such as the Apis bull worshipped at Memphis. These animals were considered living gods, and their health was meticulously monitored by specialized priests. When an Apis bull died, it was given a royal burial. Autopsies performed on their mummified remains revealed that the priests possessed a detailed understanding of bovine anatomy and pathology. They could identify conditions like osteoarthritis and infections. The care given to these animals throughout their lives was undoubtedly the pinnacle of ancient veterinary science, involving tailored diets, regular examinations, and the best available treatments. This intersection of religion and medicine created a unique environment where the drive to keep an animal healthy for spiritual reasons pushed the boundaries of practical zoological knowledge. The Egyptian approach to healing was truly universal, seeing the same principles of life and health at work in a farmer's ox, a child's dog, and a living god in bull form. This comprehensive application of their skills reveals a civilization that saw medicine not as a narrow discipline, but as a fundamental tool for maintaining harmony and well-being across the entire world they inhabited. But with such a vast and sophisticated body of medical knowledge, a critical question arises: how was this expertise preserved and transmitted across generations? How did a young person in ancient Egypt become a physician capable of performing intricate surgeries or compounding complex prescriptions? The answer lies in a highly structured system of education that combined formal institutional learning with hands-on practical training, a system designed to protect and perpetuate this invaluable science. At the heart of this educational process were two key elements: the sacred libraries known as the House of Life, and the intimate master-apprentice relationship that turned theoretical knowledge into lived experience. The foundation of all advanced learning in ancient Egypt, including medicine, was literacy. A prospective healer had to first become a scribe, This was no small feat. It required years of disciplined study to master the complex hieratic script. The primary centers for this education were the Per-A-N-K-1-E-2, 5, or houses of life. These were not standalone medical schools as we imagine them today, but rather specialized institutions attached to major temples, functioning as combinations of scriptorium, library, and university. Here, under the watchful eyes of priest-scholars, scribes would meticulously copy and recopy the great medical texts like the Edwin Smith and Ebers papyri. This was an act of both preservation and deep learning. The very process of carefully inscribing each hieratic character, each case study, and each prescription forced the student to internalize the material. They weren't just copying words, they were absorbing a methodology, the logical progression from examination to diagnosis to treatment that defined Egyptian medical practice. The House of Life was the guardian of the collective intellectual capital, ensuring that the knowledge painstakingly accumulated over centuries was not lost, but was instead faithfully reproduced for the next generation of healers. Yet, knowing the text was only half the battle, medicine is an applied science, and the crucial bridge between theory and practice was the system of apprenticeship. Once a student had demonstrated proficiency in reading and writing the medical texts, he would attach himself to an established physician, a master in the field. This was where the real education began. The young apprentice would accompany the master on his rounds, observing how he interacted with patients, how he palpated a wound, how he assessed the pulse, and how he prepared his remedies. Initially, the apprentice would act as an assistant, fetching tools, grinding herbs, and preparing bandages. Over time, as he gained trust and demonstrated competence, he would be allowed to perform simpler tasks under supervision, perhaps cleaning a minor wound or applying a poultice. This gradual, supervised progression is beautifully illustrated in tomb scenes that sometimes show multiple physicians of different ages working together, suggesting a clear hierarchy of experience. The ultimate goal was for the apprentice to not just mimic his master, but to understand the underlying principles well enough to innovate and adapt. He learned that the papyrus text was a guide, not an inflexible law. He saw how a seasoned physician might adjust a standard remedy based on a patient's unique strength or the severity of their symptoms. This mentor relationship ensured that the art of medicine, the intuition, the bedside manner, the subtle judgments that can't be written down was passed along with the scientific knowledge. It created a living chain of expertise, linking masters and students across generations. This combination of rigorous textual study in the House of Life and practical, hands-on apprenticeship produced a uniquely qualified professional, a healer who was both deeply learned in the established canon of his field and expertly skilled in its daily application, a testament to an educational system designed for both preservation and practical excellence. This profound medical tradition, so carefully cultivated along the Nile for 3,000 years, did not simply vanish with the fall of the pharaohs. Its light did not go out but was instead passed like a torch, illuminating the path for the very foundations of Western medicine, the bridge between the hall of the Egyptian SWMW and the school of the Greek philosopher-physician was both direct and undeniable, forged by travelers who journeyed to Egypt in search of wisdom they could not find at home. The most famous of these, the Greek historian Herodotus, visited Egypt in the 5th century BCE and was astounded by what he observed. He wrote with clear admiration about the highly specialized nature of Egyptian medicine, noting that each physician was a dedicated expert for a single part of the body. This level of organization, so commonplace in Egypt, was a revelation to the Greek world, and it planted a seed that would later bear fruit in a more systematic approach to health. The most significant conduit for this knowledge was the city of Alexandria, founded by Alexander the Great in 331 B.C.E. Under the Ptolemaic dynasty that followed, Alexandria became the intellectual capital of the Mediterranean, and its legendary library was the engine of this exchange. It was here that the vast medical papyri of Egypt, the accumulated knowledge of millennia, were translated, studied, and synthesized with Greek philosophical inquiry. Greek physicians, no longer mere visitors but now residents of Egypt, had unprecedented access to this treasure trove. They pored over the detailed case studies of the Edwin Smith Papyrus and the vast pharmacological lists of the Ebers Papyrus. They saw the logic of the Egyptian diagnostic method and the empirical basis of their treatments. This encounter was not a superficial borrowing of techniques, it was a fundamental reshaping of Greek medical thought, providing a solid foundation of practical clinical observation upon which they could build their own theoretical frameworks. The figure most emblematic of this transformation is Hippocrates, often called the father of Western medicine, who lived around 400 B.C.E. While it is difficult to pinpoint his direct travel to Egypt, the influence of Egyptian medicine on the school of thought that bears his name is profound and deeply embedded in the Hippocratic corpus. The most striking parallel is the concept of the four humors. The Greek system proposed that health depended on a balance of four bodily fluids: blood, phlegm, yellow bile, and black bile. This is a clear intellectual descendant of the Egyptian theory of the metu. The Greeks essentially refined the Egyptian concept of health as a proper flow through channels into a more abstracted theory of balanced liquids. The underlying principle remained identical. Illness arises from an internal imbalance or blockage within the body's systems, not merely from the whims of angry gods. Furthermore, the famous Hippocratic Oath, with its central tenet of "do no harm," echoes the sober, pragmatic triage system found in the Edwin Smith Papyrus. The Egyptian physician's decision to classify an ailment as not to be treated was a professional acknowledgement of his limits, an ethical stance to avoid causing further suffering when a cure was impossible. This rational acceptance of mortality is a cornerstone of the Hippocratic approach. The clinical methods championed by Hippocratic physicians, close observation of the patient, detailed recording of symptoms, and prognosis based on past cases are all methodologies that were already standard practice for Egyptian healers for over 1,000 years. The Hippocratic Revolution was, in many ways, the successful importation and formalization of the Egyptian medical tradition into the Greek world. This lineage becomes even more explicit with later figures like Galen, the immensely influential physician of the Roman Empire in the 2nd century C.E. Galen, whose theories would dominate European medicine for 1,500 years, openly acknowledged his debt to the Egyptians. He traveled to Alexandria to complete his medical education, recognizing it as the one place where he could study human anatomy through direct observation, a practice the Egyptians had perfected. While human dissection was controversial in the Roman world, Alexandria maintained the tradition of anatomical study, a legacy of the Egyptian focus on the physical body gained from both surgery and mummification. Galen absorbed the Egyptian emphasis on the heart as the central organ of the body's vascular system, and his own complex theories about the circulatory system are deeply indebted to the earlier model of the metu. The pharmacological knowledge he later compiled, which became the standard for the Roman world, was essentially an expanded version of the Egyptian pharmacopoeia, incorporating the same herbs, minerals, and compound formulations that had been developed on the banks of the Nile. The legacy of Egyptian medicine, therefore, flows like a subterranean river through the heart of Western medical history. Its waters nourished the roots of Greek science, which in turn were adopted and spread by the Roman Empire. Even as the Library of Alexandria faded into history, its translated texts and the ideas they contained were preserved and copied by Byzantine and Islamic scholars who served as the vital custodians of this knowledge through the European Middle Ages. When Renaissance scholars in Europe began to rediscover the works of Galen and Hippocrates, they were, often without realizing it, reconnecting with the distilled wisdom of the ancient Egyptian physicians. The bandages, the splints, the concept of diagnosis, the very idea of a rational, cause and effect approach to disease, all of these foundational elements can be traced back to the first healers who listened to a patient's chest, felt for a pulse, and understood that the body itself held the clues to its own salvation. Yet, for all its profound influence, the relationship between Egyptian and Greek medicine was far from one-sided. When we place these two great traditions side by side, a fascinating rivalry emerges, not of enemies, but of intellectual peers approaching the mystery of the human body from fundamentally different angles. The Greeks, particularly through figures like Hippocrates and later Galen, are often celebrated for their philosophical contributions, for attempting to build a grand, unified theory of health. They gave us the concept of the four humors and emphasized the importance of natural causes over supernatural ones. But if Greek medicine excelled at creating elegant theoretical frameworks, Egyptian medicine was the undisputed master of practical, hands-on application. Consider the stark difference in their starting points. A Greek physician might begin with a philosophical principle about balance in the universe, which he would then apply to the body. An Egyptian physician, by contrast, would begin with the patient, meticulously recording observable symptoms and physical signs, as we see in the Edwin Smith Papyrus. His was a medicine built from the ground up, from thousands of years of accumulated clinical experience, rather than from the top down. This practical superiority is most evident in the realm of surgery. The Egyptians, as we have seen, were performing successful trepanations and setting complex fractures with a confidence born of direct experience. Their surgical tools, made of bronze and later iron, were specialized and effective. The Greeks, while certainly knowledgeable, did not match this level of surgical sophistication. Their texts speak more of diet, exercise, and lifestyle, a preventative approach that was brilliant in its own right, but less daring in its direct physical intervention. The Egyptian mastery of pharmacology was also far more advanced. The Ebers Papyrus, with its hundreds of specific, complex recipes, demonstrates a deep, empirical knowledge of herbal and mineral chemistry that the Greek texts simply do not replicate in the same detail. The Egyptian physician had a vast natural pharmacy at his disposal, with proven remedies for everything from infections to constipation, while the Greek pharmacopoeia, though significant, was often more theoretical. Where the Greeks truly broke new ground was in the realm of theoretical physiology. They sought to explain the why behind the what. The Egyptian concept of the metu was a functional model, a description of the body as a hydraulic system. The Greek theory of the four humors was an attempt at a deeper, more philosophical explanation, linking the body's health to the fundamental elements of the universe: earth, air, fire, and water. This was a powerful intellectual leap that gave medicine a new kind of explanatory power. Furthermore, the Greek emphasis on prognosis, on predicting the course of a disease based on careful observation, was systematized in a way that became a cornerstone of their practice. The famous Hippocratic face, the description of the countenance of a dying patient, is a testament to this intense focus on the natural progression of illness. In this area, the Greeks refined the observational techniques the Egyptians pioneered into a more formalized scientific method. So, who wins this ancient rivalry? The answer is not about declaring a single victor, but about appreciating their complementary strengths. In their own time, for treating a traumatic injury, a severe infection, or a dental abscess, you would almost certainly have been better off in the hands of an Egyptian specialist. Their medicine was more immediately effective, more technologically advanced in its surgical and pharmaceutical applications, It was a system designed for results. The Greek approach, however, laid the philosophical groundwork for medicine as a rational, secular science for the Western world. They took the empirical data collected by the Egyptians over millennia and built a theoretical structure around it. The true legacy is a fusion. The Greek philosophical framework was like a new, elegant vessel, but it was the Egyptian wine of practical knowledge that first filled it. Together, these two traditions created the bedrock upon which all of modern medicine would eventually be built, a testament to the fact that healing the human body requires both the surgeon's precise hand and the philosopher's inquiring mind. For centuries, the medical papyri of ancient Egypt were viewed by many scholars as fascinating relics, but largely as a collection of superstitious recipes. The rational brilliance of the Edwin Smith papyrus was acknowledged, but the vast pharmacopoeia of the Ebers papyrus, with its spells and strange ingredients, was often dismissed as primitive guesswork. Modern science, however, is forcing a dramatic re-evaluation. Armed with advanced chemical analysis and rigorous clinical testing, researchers are discovering that many of these ancient remedies were not just placebo, they were genuinely effective, and we are only now beginning to understand the sophisticated biochemistry that the Egyptians stumbled upon through centuries of careful, empirical trial and error. Take their most famous remedy, honey. The Ebers Papyrus lists it in dozens of prescriptions, primarily for treating open wounds and burns. We now know that honey is a powerhouse of natural medicine. Its incredibly high sugar concentration creates an osmotic effect, literally pulling moisture out of bacterial cells, causing them to shrivel and die. It also contains an enzyme called glucose oxidase, which slowly releases low levels of hydrogen peroxide, a potent antiseptic, providing a continuous, gentle cleansing action. Furthermore, honey forms a protective barrier over a wound, creating a moist healing environment that promotes tissue regeneration. What the Egyptian physician observed as preventing rot was, in fact, a powerful, broad-spectrum antibacterial and anti-inflammatory treatment. Modern medical-grade honey is now used in specialized wound clinics around the world to treat stubborn infections, particularly those resistant to antibiotics, proving that the ancient healers were onto something profound. The validation extends far beyond honey. Consider their use of willow bark for pain and fever. The Ebers Papyrus includes instructions for preparing a tea from willow bark to alleviate aches. The active compound in willow is salicin, which the human liver converts into salicylic acid. This is the direct chemical precursor to acetylsalicylic acid, which the world now knows as aspirin. While the Egyptians didn't isolate the pure compound, they had identified the plant source of one of the most important pain-relieving and anti-inflammatory drugs in history. Similarly, they used garlic extensively, not just as food but as medicine. We now understand that garlic contains allicin, a compound with potent antimicrobial and antifungal properties. Feeding garlic to laborers, as some texts suggest, may have been a practical strategy to boost their immune systems and reduce the incidence of illness, a primitive form of preventative health care. Perhaps one of the most surprising modern confirmations involves their treatment for eye infections. The papyri prescribe a powder made from malachite, a green copper ore, to be applied to the eyes. For a long time, this was seen as a potentially harmful practice. However, research has shown that copper salts do indeed have significant antibacterial properties. In an era before antibiotics, a malachite powder may have been genuinely effective against common bacterial conjunctivitis or trachoma, a devastating eye disease that was endemic in the ancient world. Their use of yeast, often from beer, to treat digestive ailments and skin infections is another stroke of genius. applying a yeast poultice introduces beneficial fungi that can outcompete harmful bacteria, a primitive form of probiotic therapy that aligns perfectly with modern understandings of microbiome health. This scientific validation challenges the old dichotomy between Egyptian magic and Greek science. It suggests that the Egyptian approach, which blended practical recipes with incantations, was deeply rational at its core. The incantation might have been the delivery system for the patient's mind, a way to inspire confidence and activate the placebo effect, but the remedy itself was often a chemically active substance with a real physiological impact. They were not merely guessing, they were observing outcomes over generations. If a poultice of honey and lint repeatedly led to a cleanly healed wound, it was recorded and passed down. If a tea made from a certain berry relieved stomach cramps, it became part of the canon. This was evidence-based medicine in its earliest form. The modern laboratory is now providing the molecular explanations for what the Egyptian physicians knew empirically, that nature's pharmacy held powerful tools for healing, and their meticulous, generations-long research project had uncovered some of its most valuable secrets. Despite this wealth of evidence for their sophisticated and systematic approach, the story of Egyptian medicine is often clouded by persistent myths and oversimplifications. These tales, while dramatic, can obscure the true nature of their achievements, reducing a complex science to a series of lucky accidents or crude barbarism. It is time to separate the fascinating facts from the misleading fiction, starting with one of the most enduring legends, the idea that the Egyptians practiced a primitive form of antibiotic therapy with moldy bread. This story usually goes that they discovered penicillin millennia before Alexander Fleming, administering it to fight internal infections. The reality, as is often the case, is more nuanced and in many ways even more clever. While there are indeed prescriptions in the medical papyri that call for the application of moldy bread or soil rich in mold to wounds, the crucial distinction lies in the application. The Egyptians were not grinding up the mold and having patients swallow it to cure a systemic illness like pneumonia. Their use was entirely topical, meaning it was applied directly to the surface of an infected cut or burn. They observed through generations of trial and error that when a poultice made from certain molds was placed on a wound, it seemed to prevent the dreaded redness, swelling, and pus that indicated decay. They had no concept of bacteria or antibiotics. What they saw was that this particular treatment counteracted the process of putrefaction, which was the physical manifestation of their concept of wehidu. Modern science explains this beautifully. Many molds, including those from the Penicillium genus, produce antibiotic substances that kill bacteria on contact. So, while they were not using systemic antibiotics as we know them, they were harnessing the antibacterial properties of molds in a localized, practical, and genuinely effective way. This wasn't a random guess. It was a deliberate therapeutic strategy born from meticulous observation. Another widespread misconception surrounds the practice of mummification, often depicted as a gruesome and clumsy affair, particularly the removal of the brain. The classic image is of an embalmer unceremoniously scrambling the brain with a hook through the nose and discarding it as worthless. This could not be further from the truth. The process was a highly ritualized and delicate surgical procedure, performed with remarkable precision and respect. The brain was not considered unimportant. In fact, the opposite was true. The Egyptians believed the heart was the seat of intelligence, memory, and the soul, but they still undertook the challenging task of removing the brain to ensure the body's preservation for the afterlife. The method they developed showcases their anatomical ingenuity. They did not crush the brain. Instead, using a long, bronze hook inserted through the ethmoid bone, a delicate plate at the top of the nasal cavity, they would gently maneuver it to liquefy the brain tissue. By carefully stirring and breaking it down, they could then turn the body over and allow the liquefied matter to drain out through the nostrils. In some cases, they would then rinse the cranial cavity with palm wine or other aromatic fluids to cleanse and deodorize it. This was not a crude destruction, but a calculated dissolution, a technique designed to remove organic matter from a sealed space with minimal damage to the skull's structure. The fact that they identified this narrow, indirect pathway into the cranium, avoiding the much more destructive alternative of breaking open the skull, is a testament to their intimate knowledge of human anatomy and their commitment to preserving the body's outer form. It was a purposeful, refined technique, not a brutish act. A third myth that deserves debunking is the notion that Egyptian medicine was stagnant, unchanged for 3,000 years. This view imagines a civilization blindly following the same papyrus scrolls without innovation or progress. The archaeological and textual record, however, tells a story of dynamic evolution. While the core principles established in texts like the Edwin Smith Papyrus remained influential, there is clear evidence of development. Later medical texts show the introduction of new ingredients from trade with neighboring cultures in Nubia, Punt, and the Near East, expanding their pharmacopoeia. Surgical tools evolved from flint and copper to sharper, more durable bronze and, eventually, iron. The very structure of the medical profession became more specialized over time. Furthermore, the influence flowed in both directions. During the Greek and Roman periods, Egyptian physicians absorbed ideas from these new ruling powers while also teaching them, creating a hybrid medical culture in cities like Alexandria. To say Egyptian medicine was unchanging is to ignore the vibrant intellectual exchange and practical adaptations that occurred over its immense lifespan. Their system was a living tradition, one that respected its foundational texts, but was not afraid to incorporate new knowledge and refine its techniques, proving itself to be as resilient and adaptable as the civilization that created it. Yet for all their profound insights and practical genius, the Egyptian medical system was not without its boundaries, areas where even their advanced knowledge reached its limits. To truly appreciate their achievements, we must also acknowledge the frontiers they could not cross, the invisible barriers imposed by the world as they understood it. One of the most significant limitations stemmed from a simple, unavoidable reality: they had no concept of the microbial world, the entire universe of bacteria, viruses, and parasites. The true causes of so much human suffering was completely invisible to them. They could observe the effects of an infection with stunning accuracy, the heat of a fever, the pus of a wound, the swelling of a limb. They correctly identified this process as putrefaction, a state of decay, and they developed brilliant methods to combat it, such as using honey's antibacterial properties. But they could never know the true, microscopic agents at work. This fundamental gap meant that their understanding of contagious diseases was inevitably framed in spiritual or environmental terms. A plague sweeping through a village was attributed to the wrath of the goddess Sekhmet or a miasma of corrupted air, rather than person-to-person transmission of a pathogen. Consequently, while their public hygiene practices were excellent and undoubtedly reduced infection rates, their preventative measures against epidemics were rooted in ritual purification and quarantine driven by religious doctrine, not a scientific understanding of contagion. This lack of microbiology also shaped their approach to internal medicine in profound ways. They understood blockages in the metu, but they could not conceive of a blockage caused by a microscopic parasite or a bacterial colony. A disease like malaria, with its cycles of fever and chills, would have been a deeply puzzling condition. They might treat the symptoms with fever-reducing herbs like willow bark, but they could not address the underlying cause transmitted by a mosquito bite. Their model of the body as a system of channels was brilliant for its time and allowed for effective treatments of trauma and many ailments, but it was ultimately a macroscopic model. It could not account for the cellular and subcellular processes that are the foundation of modern medicine. This is not a failure on their part, but rather a testament to the technological constraints of their era. Their medicine was based on what they could see, touch, smell, and reason from direct observation. The world of the infinitesimally small remained a locked door, and without the key of the microscope, their understanding of disease causation was destined to remain incomplete. A second major limitation, one that had lasting consequences for anatomical science, was their unwavering belief that the heart was the seat of intelligence, emotion, and memory. In their physiological model, the heart was the central organ, the master of the body's metu network, and the source of a person's very being. This concept is powerfully expressed in the Book of the Dead, where the heart of the deceased is weighed against the feather of truth in the afterlife. It was the repository of a person's character and deeds. This belief, while philosophically rich, meant that the brain was significantly undervalued. They observed the effects of head injuries with remarkable precision, even noting that damage to one side of the brain could cause paralysis on the opposite side of the body. Yet they interpreted these findings through the lens of their core belief. They saw the brain not as the generator of thought, but perhaps as a cooling organ for the blood, or simply as a mysterious substance with some connection to the all-important heart. This misattribution of functions stunted the development of neurology as a distinct field. While they were masterful at treating skull fractures, they never pursued a deeper understanding of how the brain itself worked, because in their worldview, the true center of consciousness lay in the chest. This cardiac-centric view also influenced their diagnostic methods. They placed immense importance on the pulse, feeling it at various points to assess the flow through the metu, which they believed originated from the heart's power. But their pulse diagnosis was qualitative, focused on strength and rhythm as indicators of systemic flow, not as a direct window into the brain's functions. They were listening to the heart for clues about the entire body, but they were not looking to the head for the origins of thought or personality. This fundamental misconception was passed down through the Greeks and Romans, most notably to Galen, and it dominated Western medical thought for over a millennium after the fall of Egypt. It stands as a poignant example of how even the most brilliant and observant culture can be led astray by a powerful, core belief that colors all subsequent interpretation of evidence. Finally, for all their rationalism, there remained a category of illness where their empirical methods faltered, and they turned almost entirely to magical cures. When faced with complex, internal diseases that presented with confusing or systemic symptoms, conditions we might now identify as cancer, autoimmune disorders, or advanced organ failure, their logical system of examination and diagnosis often reached a dead end. If no external cause like a wound could be found, and if the symptoms did not clearly point to a blockage that could be purged, the explanation defaulted to the supernatural. A wasting disease, a sudden paralysis with no trauma, or a mysterious skin condition was likely interpreted as the work of a demon, a ghost, or a curse cast by an enemy. The treatments for these ailments, as detailed in papyri like the Ebers, become a fascinating blend of the practical and the purely mystical. A prescription might include a legitimate herbal remedy to soothe the symptoms, but it would be accompanied by an elaborate spell intended to drive out the invading spirit. This reliance on magic was not a sign of ignorance across the board, but rather a pragmatic admission of the limits of their current knowledge. The incantation was a tool to be used when physical tools failed. It provided a framework for understanding the incomprehensible and offered hope to the patient and the physician alike in the face of a hopeless situation. This duality is perfectly captured in their approach to what we would call mental illness. They might prescribe a soothing bath with calming herbs, a rational enough therapy, but also have the patient wear an amulet inscribed with a protective spell to banish the chaotic spirits causing the confusion in the mind. Recognizing this boundary is crucial for a balanced view. It shows that Egyptian medicine was a system evolving in real time, brilliantly effective within its sphere of understanding, yet still grappling with the profound mysteries of the human condition that, in some ways, continue to challenge us even today. Their greatness lies not in being infallible, but in building a lasting edifice of medical science with the tools and knowledge they possessed, while honestly confronting the unknown with the only other tools they had, faith and ritual. So, after this deep exploration, we return to our original question: why is Egyptian medicine considered surprisingly advanced? The word surprisingly is key, and it hinges on a fundamental reassessment of the timeline of human progress. We are surprised because we have long been taught a narrative that places the birth of rational medicine in classical Greece with Hippocrates and his followers. But the evidence from the Nile Valley forces a dramatic rewrite of that story. The Edwin Smith Papyrus, a text of pure clinical observation, dates to around 1600 BCE, and it is itself a copy of even older knowledge, possibly reaching back to the age of the pyramids around 2600 BCE. This means that 1,000 years before Hippocrates walked the earth, Egyptian physicians were already following a rigorous method of examination, diagnosis, and prognosis. They were setting fractures, stitching wounds, and performing trepanations with a success rate that commands respect. The surprise comes from realizing that the so-called father of medicine was, in many ways, a beneficiary of a medical tradition that was already ancient. This surprise deepens when we consider the foundation of their knowledge. Without microscopes or an understanding of germ theory, their entire system was built on the most powerful tool available: relentless, meticulous observation. They were masters of looking at the human body and its ailments, and then reasoning backwards from effect to cause. A physician treating a head injury would note the clear fluid dripping from the nose and correctly deduce a fracture deep within the skull. They observed that damage to one side of the brain caused paralysis on the opposite side of the body. They saw that honey prevented wounds from festering, that willow bark eased pain, and that certain molds could cleanse an infection. This was not guesswork, it was proto-science. They developed a coherent, logical model of the body as a system of channels, the metu, and this model, while different from our own, was sophisticated enough to guide effective treatments for a vast range of conditions. Their advancements are surprising because they achieved so much with the tools they had, building an entire medical edifice on the bedrock of empirical evidence gathered over 3,000 years of continuous practice. Furthermore, the surprise stems from their sheer sophistication in specific, high-stakes areas, particularly trauma care. In the realm of emergency medicine, an Egyptian physician from the Old Kingdom would not have been out of place in a military field hospital centuries later. Their understanding of how to stabilize a patient, classify injuries based on survivability, and implement rational treatments like honey-soaked bandages and mechanical jaw reduction was unparalleled in the ancient world for millennia. The fact that we have physical proof of their success, a skull showing healed trepanation, a dog's leg that had been set and mended, a functional wooden toe worn smooth by years of use makes their achievements tangibly real. We are surprised because we struggle to reconcile the image of pyramid builders with that of skilled surgeons, but the evidence is incontrovertible. They possessed a pragmatic, hands-on brilliance in dealing with physical trauma that would not be systematically surpassed until the modern era. Ultimately, the greatest surprise may be the holistic nature of their system, a quality modern medicine is only recently striving to reclaim. They saw no contradiction between a physical remedy and a spiritual incantation because they treated the patient as an entire being. Their medicine addressed pain, but also fear. It healed the body, but also sought to calm the mind. This integration, which we might now call a biopsychosocial approach, demonstrates a profound wisdom that transcends mere technique. So, Egyptian medicine is surprisingly advanced because it forces us to confront our own chronological snobbery. It reveals a depth of human ingenuity that flourished in an era we have prematurely labeled primitive. Their legacy is not a collection of curious antiquities, but a testament to the timeless principles of careful observation, logical reasoning, and compassionate care, principles that remain the very heart of healing itself. As we bring our exploration to a close, the full picture of ancient Egyptian medicine emerges not as a hazy collection of superstitions, but as a brilliantly constructed system of healing, built on pillars that would not be rivaled for millennia. We have journeyed through the very texts that guided these physicians, the Edwin Smith and Ebers papyri, which reveal a methodology of breathtaking logic, a consistent process of examination, diagnosis, and prognosis that feels remarkably modern. We have encountered a world with specialized doctors, not generalists, where an expert for the eyes or the teeth was a standard feature of society, a concept that would disappear for centuries after the Niles civilization faded. The evidence of their surgical skill is etched into the bones of their patients, from the healed trepanation that proves successful brain surgery to the functional prosthetic toe worn smooth by years of use, demonstrating a commitment to restoring quality of life. And perhaps most astonishingly, their pharmacy was a treasure trove of natural chemistry, using honey as a powerful antibiotic, willow bark as a precursor to aspirin, and molds to fight infection, remedies that modern science is only now fully validating. This was not mere trial and error, it was a sophisticated, documented, and cumulative science. The true measure of their genius, however, lies not in any single technique, but in the powerful combination of all these elements. It was the stability of their society, gifted by the Nile, that allowed for the creation of medical libraries and the training of professionals. It was their development of writing that enabled knowledge to be preserved and refined across generations. Their theoretical model of the body's metu, while different from our own, provided a logical framework that guided effective treatments for thousands of years. And their holistic approach, which saw no contradiction between a physical bandage and a spiritual incantation, treated the patient as a complete being, body, mind, and spirit. They were empiricists who trusted their observations, innovators who were not afraid to intervene directly with scalpel and splint, and compassionate healers who sought to alleviate suffering in all its forms. The legacy of these first physicians is woven into the very fabric of modern medicine. Their practical knowledge flowed across the Mediterranean, providing the essential clinical foundation upon which Greek thinkers would build their philosophical theories. The next time you hear a doctor discuss a prognosis or feel your pulse at a checkup, you are witnessing the echo of a practice perfected along the Nile. The story of Egyptian medicine is ultimately a story of human ingenuity at its most resilient. It forces us to rethink our timeline of progress and humbles our modern arrogance, reminding us that profound wisdom can flourish in the most ancient of times. Their achievements stand as a timeless testament to the universal human drive to understand, to heal, and to persevere against the ravages of disease and injury. So, we turn the question over to you. After this journey into the world of the SWNW, the Egyptian physician, what fact astonished you the most? Was it the successful brain surgery, the advanced pregnancy tests, or the detailed understanding of the pulse? And what other secrets of the ancient world would you like us to uncover next? Share your thoughts, and let's continue this exploration of our shared human story together.